Okay.
Yet another year, and you're
one thing is possible. I would like to leave around 6:45 to 6:50 because I have another
doctors,
coming up at 7
healthcare
o'clock.
workers, medical staff members are leading the battle.
Your voice is interrupting.
Network issue.
Once again from the front. The sacrifice that
there's some problem. Chandrika, stop. Let me start. So here it is. A very good evening. I'm Rakhi Bakshi from Her World India. Welcome you all. We are partnering with the Policy Center and Gender Lab Miranda House, which we do every time that we come on this show. And we have been bringing you this show every Saturday. But during these times, which are critical and crucial, and COVID-19 has struck us, we have started to do it almost daily and regularly. Today, we are again discussing a very, very significant topic as to how exactly at this stage we are dealing with this pandemic. We saw it coming last year, but this time we know this is the second wave. Already third wave is being discussed, but what are the realities, what we need to do to discuss that? We have two very eminent speakers. We have Dr. Arun Gupta, who is the president of Delhi Medical Council. We are so thankful that amidst his very busy schedule, he's joined us and he'll be sharing with us some very valuable insights. We also have Dr. Bishwajit talking from Birmingham, UK, and somebody, of course, who hails from Manipur. And we're so happy, sir, that you've gone there, but you're looking at India and also at the global perspective, and who looks especially at internal medicine and will talk about the virus and its various dimensions. So at this stage, I welcome all of you participants, viewers. You can ask in some questions which you can write in, which I'll try and take up. Otherwise, you can also come in and ask them. It's very important to look at what currently is happening. Of course, on social media, there's a lot of panic. People are trying to seek help from each other. We know that there is oxygen crisis going on, medical facilities, beds, ventilators, ICU. These are the words that we keep hearing. We really want everyone to be safe and healthy, but I think it sometimes goes beyond. So Dr. Arun Gupta, to you first. Delhi, as we speak, is really facing a lot of problems. All eyeballs, all eyes are on the capital as to what's happening, despite now assurances that sufficiently vaccination is happening, oxygen is being provided. We know that there is scarcity. Patients are really, really troubled. What would you say right now, Dr. Arun Gupta?
Yeah, I think it's almost a month now when we are into this current wave of corona pandemic. Initially, things were not really difficult, but once the things number of cases start escalating, the simultaneously we had to increase the number of beds also. Now, right now in Delhi, we have more than 5,000 beds lying vacant, I would say. All the government sector as well as the private sector, but the problem is all availability of oxygen. Now, there's no point in keeping a bed unless you can provide the basic oxygenation. Hospital doesn't make bed only. So we have been trying to upscale this thing. We have been trying to talk to various government, central government, so that they can upscale the demand of Delhi as far as oxygen is concerned. So that is the biggest challenge right now for all of us in Delhi. So how to increase the number of oxygen beds. Otherwise things are not really bad, but once the oxygen is, the basic things are not here. There are a lot of anxiety, a lot of clamoring in the people as well as the hospitals. They are under stress all the time. Someone has oxygen left for only 2 hours, someone has oxygen left for only 4 hours. And not only scarcity of oxygen, it's all about inconsistent and irregular supply of oxygen as well. So that is kind of putting a lot of stress in medical community as well as authorities. So otherwise, after the first wave or second wave, we are better prepared in Delhi, I would say. But unfortunately, the large number of sick patients are coming this time, and eventually they all need oxygen. So that is where we are actually stuck. Otherwise, I think Delhi is coping well with the situation.
Would you like to clarify on this, that some people would say that whether everybody exactly needs that much of oxygen or not? I mean, we keep hearing this word, almost has become a buzzword, oxygen. But how much is it needed? Of course, we know that the center is being even told to give Delhi as much as oxygen supply as it needs. But how much of it is really, really specifically wanted, sir?
You see, the large number of patients, they remain asymptomatic, COVID also. Now, the patients who are mildly symptomatic, like mild fever, cough, and body ache. They can be managed home as long as the oxygen saturation is maintained. Now, the person whose saturation goes below 93 and further, the mainstay of treatment remains the oxygen for them. Now, because here large number of patients this time, the number of patients who fall in this category, who need oxygen is actually huge. We have an increasing number of beds in Delhi and Leap and Bound. Now we have more than 19,000 beds working in Delhi. But the problem still remains the oxygen. If we have liberal supply oxygen, we can in a day or two we can add another 9 to 10,000 beds in Delhi. So that is the buzz, and you must be hearing all other people are calling. You must be calling you also. Please arrange a bed. Please arrange a bed, oxygen bed. So otherwise, to manage the patient who are at home, they don't need oxygen is not a big issue. That is being done very well by volunteers and doctors. So ultimately it comes down to the supply of oxygen. And what is the criteria of oxygen? It's all stipulated by the central government as per their calculation. And oxygen in an oxygen bed, you need a 10-liter oxygen per minute. And an ICU bed, you need 24-liter oxygen per minute. Now, according to this formula, when you calculate the need of Delhi, it comes to around 900 MT. But they were not getting more than 400 and 500 metric ton. Yesterday they got 730 something, but the day before yesterday they got 730 something, and yesterday they all got 577. So this gap of demand and supply is always there, and this is the main thing which we are facing, all of us facing for the last 10 years.
Sure, and we are actually keeping a watch on that, and everybody feels concerned that the right kind of demand which is coming in, there should be adequate supply available also, and we'll keep, of course, looking at that. I go to Dr. Biswajit now. Speaking from India, we welcome you, but this is exactly not the best time to also even indulge in pleasantries, and without wasting any much time, we'll say, how are you looking at India? I mean, you, of course, belong to the country, but you're there looking at things from a little global perspective also. How serious is the situation at this stage that we are in the first week of May, Dr. Biswajit?
Hi, thank you very much again for having me. It's a really excellent opportunity for me to share some of my views, which I feel can help. To be honest, it is very scary, it's very concerning, and I believe India is in a very, very serious condition. But there is hope, and I will tell you the evidence. In United Kingdom, yesterday, there were 2,200, around 2,200 positive cases, new cases, and 13 deaths, so 13, right? This is the same as a number of people who have died back home in my state of Manipur, all right? So what I'm trying to say is, everybody can remember how United Kingdom was there around 2 to 3 months ago. You know, you see ambulance lining up, you see hospitals, you know, struggling very hard. But we know that if we do the things that we have to do, including vaccination, it can be brought down. And today in United Kingdom, there's only, so it was only yesterday that was 13. Day before yesterday, there was only 2 deaths. The whole of United Kingdom, only 2 persons died because of COVID a couple of days ago. So it means it is possible to control this virus. But how do we do it? Yeah, and why we have to do it? We all know that we want to control it. We all know that we have to control it. I myself, along with some friends in the place where I work and with the community of Manipur that we have here, we have raised around some money to get oxygen concentrator back home because people are struggling. And it's not just in isolation in Manipur, it's everywhere in India. Delhi particularly is really struggling. And I really, really feel bad. And I really feel and I wish I could do something. And this is why I came onto your talk to see whether I could be of any help. All right. So we can do something. We can control this. And how do we control? So UK use 2 things. One is the vaccine, okay, and that is going on. The other one is the personal responsibility of everyone, okay, and we can control it by using no money at all. All we have to do is to make sure we do not meet anyone apart from the people that we live in our house. If I live with my family in my house, please do not meet anyone, because the whole idea about lockdown, the whole idea about containment zone is to make sure that people doesn't meet. But suppose even if there's a lockdown, I go and meet my neighbors. My neighbors comes to me, or I go and meet my uncle. I go and meet my parents who lives next door. The virus will continue to spread. And we know in India that when people get infected, is whole families are getting infected. One person gets infected and get transmitted to everyone. And that transmission happens to the neighbor. So the whole flat, the whole apartment getting infected. And we have to stop that. So a couple of things that we have to do is please do not meet anyone who is not from your house. If you are somebody who is working and no have choice and you have to go out, then you have to protect and shield. Do shielding for your vulnerable member of your family. If you got a mother or a father or a grandparents who are who are vulnerable, then do not meet them. If you have to meet them, make sure there's a barrier. Okay, that's very, very important, because that's how we're going to stop the virus. And if you actually have to meet, and there is no other way, oh, I need to meet my mother, or I need to meet my neighbor, please meet outdoors. You meet them outdoors, not inside a house or inside a room, because the virus gets infection. It's much worse when we meet inside a door, inside indoors.
Okay, so that's very valuable and important issue. Point that you have really shared with us, Dr. Bishwajit. I repeat it once again: do not meet anyone, who you do not need to meet so urgently. Do not meet them indoors. Meet them outdoors. And that is the whole idea of, strictly speaking, social distancing. And these are no time to actually meet. And I think we have committed some errors already of not really looking at crowds that we mingled earlier in. So would you also say, Dr. Gupta, that, while we are saying that what the authorities are doing at this hour, we as citizens also really needed to be alert? How would you really look at, our own understanding of a virus like this?
I think if you see the behavior of virus, I think that it was behaving in a different way last week, and this time its behavior is different also. Having said that, I think people could understand. Actually, late December or January, somewhere people started believing that Corona is over, and that message was conveyed directly or indirectly by our authorities also. If you're conducting elections, rally the elections, people will participate over mass, and your everything, your open market is open, weddings are people. It gives indirect message to people that everything is all right. So people started taking this thing lightly. Also, they thought probably Corona has come, and I would say 1 year of Corona was also certain. Number 3, I think somewhere we didn't take vaccination that much seriously also. I think we missed the opportunity. January we started the vaccination, now May. January, February, March, the government could have done it at a really large scale, so that we could, like the UK and USA and Israel did it. We were very, very slow in that. I think there were so many factors. People were complacent, but the signal people getting from the authorities were equally wrong.
Okay, so how does one say that, somebody would argue that, okay, this is a pandemic, finally, it has come and struck us, the new mutant, we could not understand much. We are still studying. In fact, we have confusing statements coming out saying whether a third wave is going to be on or not. How would you really look at the current time? I know that vaccination drive is very much on. That is the best step to actually prevent people and look at the healthcare. How equipped are we, Dr. Gupta, at this stage to look at the kind of infrastructure that we must have?
I think you look at it this way. Now, this current wave, also talking about current wave, this current wave will not going to be affected by your vaccination drug, because they once start vaccinating, the people get immunity after almost 2.5 months. Because you give first dose, then you get the second dose, and you get immunity of 15 days after the second vaccine. So that a massive vaccination drive might prevent or flatten the upcoming wave. For this, we have to contain. We have to be very, very strict about what we call lockdown or local containment zone. People have to stay within their house also. And this behavior is this virus is behaving it strange in a way that it's so infectious that practically everyone in the family gets affected. So one need to be very sure. If you have any doubt or you have been going out, then you need to wear mask within the house also. As a pediatrician, this time also I'm seeing that a lot of kids are also getting affected, which was not earlier the last phase. The kids are getting affected, they are getting symptomatic, they are getting seriously ill also. So even the virus is also changing its behavior. So if the virus is changing behavior and you have to survive, then you have to adopt the things in probably most stringent way. I would say it has to be done.
Sure. One thing again I want to know from you is that right now as we're speaking, you also are aware that one of the persons who's a restaurant owner in Khan Market, I mean, the news is that he's been caught because he was hoarding, oxygen concentrator. So at this time, as maybe it happens in pandemic, the behavior of becoming, too greedy, trying to hoard, black marketing. But how would you look at this situation, and what kind of, arrangement? Let's say a medical fraternity would show concern and the government should kind of take steps, or the center should have a coordinated approach?
I think during last year, when the corona started till now, almost 1,000 doctors across the country had lost their life. Nothing sacrifice can be bigger than this. This kind of war and we are fighting it. Now, in this amidst of this war, I as a doctor expect a more responsible behavior, not only from public, not only the traders who are doing this business, but also from the government. We expect everyone to behave with more responsibly. अगर आप एक साल election नहीं करोगे तो nothing, nobody is going to die because of the lack of elections. He's postponed everything. We are at a war, people are dying. And people who are doing hoarding and these things are there. These people are good and bad people are always in society. But it's up to government to look into this matter. If the government has enough power, they wield their power in a proper way. I don't think these people can get away with it. I think it's a responsibility, collective responsibility. Medical fraternity, all doctors, nurses, and everyone is fighting like anything. So, but we need a responsible behavior from everyone else.
One gets shocked that, today, of course, we were trying to find a remdesivir, and somebody would say that the prices are so high, so unbelievably high, that, one gets shocked, double shocked, that how to deal with the disease and how to deal with the financial aspect or arrangement of it all. I'll come back to you on that also, Dr. Gupta, but let me go to Dr. Bishwajit. Dr. Bishwajit, what other advice, steps that you would think are very urgent that people should also undertake, and what the government should also do? We know at this stage, foreign countries are also trying to help, but what is it that the government should immediately look at? I can tell you from my side, I've been saying this, there should be a national COVID desk here, which I do not see in place even at this stage. Steps like these, if some of these steps that you could advise, things that are happening, let's say outside, and we could do here, what would those be?
I think that's a very difficult question, isn't it? But probably the most important question, and I completely agree with you that we need to have a national task force or a national committee that directs the whole country. I will be quite surprised if it's not there, but if it's not there, then that's something that I believe Dr. Arun Gupta and his colleagues will look into. But that's very, very important, because what we need is coordination. For me, is just to continue from the last one, is, we people talk about masks and people are talking about hand washing. I think that's another very, very important thing to stop the virus transmitting. So we all know that we all wear masks. Okay, please remember that we are wearing masks not just to protect ourselves, but to protect others as well. So if I'm meeting you, say for example, somewhere in a college or I will be wearing masks because I don't know whether I'm getting infected and I don't want to pass on to you. So two things, I'm wearing the mask not to get myself infected, as well as to protect my friends and family, the people that we are meeting. Okay. Other one is when we wash our hand, we keep washing our hand. But please, it's very, very important that if you got long sleeves and you wash your hand, the virus will get around this. And we do not really clean this part of the shields. So if you are going to a high risk area or a risk area where you are worried, please make sure your shelves are rolled up, your elbow and wrists are empty, so that when you wash your hand, you're washing your wrists and your hands. That way, you do not get infected, because we don't want the top of your shirts to get infected and not washed properly. Little things, but huge difference. In the United Kingdom, it's a law. It is required by all healthcare professionals that we are bare below our elbow. So nothing should be there below, and no wristwatch, nothing, because that's how we stop the virus from transmitting. Very, very important. Now, other one is people keep talking about remdesivir and lots of medications when people get COVID infection. The best treatment for COVID infection or any other infection, apart from the antibiotics, apart from the antiviral, is good food. Good food and lots of water, soup, and fluids. What is happening, what we see in my practice, I'm an emergency medicine specialist, actually.
Yeah.
So what we see is we've got lots of people who had not been eating and drinking well for 3, 4 days, 5 days, 6 days because of the virus. They don't want to eat and drink. And when they come to the hospital, they're very, very tired. Their kidneys are dry. They have kidney failure. So if somebody is infected or not infected, please make sure you're eating and drinking well, because we do not want you to lose the inertia.
Can I at this stage just ask you a question that people sometimes think, they say that the symptoms are that you have a little sore throat, then you have fever, and then you're coughing and your chest feels heavy, and then you have breathlessness. But sometimes people think, how to segregate this from a common cold and cough, and whether to decide whether it's actually going to be COVID positive behavior. So what would you say? How would you really clear that cloud of what exactly would look like a serious COVID infection?
I think one has to be very, very clever to differentiate, because it's difficult. It's very, very difficult. We have seen COVID infection in people who come with stroke. We have seen COVID infection in people who come with symptoms of heart attack, people who come with confusion. So there's nothing. Yes, most common symptoms are fever, sore throat, cough, and difficulty in breathing. But you can have other symptoms. My suggestion is, in the current state of India, where there is so much infection, if anybody is unwell, you got COVID infection. Okay. Until proven otherwise. That way, you can start taking the precautions to avoid infecting others, okay, and start looking after yourself and get appropriate advice. So yes, if somebody has got fever, cough, and difficulty in breathing, it's most likely COVID. But even if they don't have it, please think that you might have COVID and take precaution that they don't infect others.
And Dr. Bishwajit, would you also say that in India, we are saying that, other things that you should do is do pranayama. We're talking a lot about proning, the breathing exercises, and other exercises, yoga and all. What would you really say that how much of it should be like suitable to the kind of problem one is having?
Any physical exercise, any meditation, they are excellent form of anything in any way, even from the COVID pandemic. I would suggest and advise and encourage people to do yoga, exercise. Yeah. Proning is a bit different, okay? So I'll come to that. But yes, any physical exercise, please do it, because you want to increase the reserve of your body when you become unwell. So COVID is something like, if you run a marathon, you need a lot of practice, isn't it? But if I have never run a marathon and I try to run a marathon, I will become very, very tired soon. So when COVID infection comes in, our heart is working harder, kidneys are working harder, our breathing is working harder. And if we got the reserve, if we are stronger, then we can fight it better. So this is important.
Okay. I'll come back to you with some of these pertinent questions, but let me go to Dr. Gupta and say, Dr. Gupta, we see a lot of panic, anxiety. Now, how much of it, somebody would say that in some cities, it's happening in UP. Sometimes we hear that, some people did not need the bed exactly, but they have occupied beds because they in advance think that I would need it. And so how much of them actually need it because of seriousness of the disease? These kind of confusions, which comes out of lack of proper medical understanding also, and even common understanding about health issues. So our health awareness, I would say personally, also having seen, should be much more. I'm talking a lot about health infrastructure being in place, this coordination, the federal system also, you understand, Dr. Gupta, is something that we are really, really talking a lot about. But as a medical practitioner, what are the things you would also suggest?
I think I'm not sure about what is happening in other part of the country, but in Delhi, we have a very, very good system where every patient who is at home and who has some symptoms is getting call from doctors regularly so that they are a bit comfortable, and doctors regularly inquire about their health. There are certain vitals about saturation, their temperature, their pulse rate, their respiratory rate, etc. So that gives a lot of confidence to patients that they are being looked into. And in case they have some problem, we have an arrangement where ambulance just gets there and take them to a nearby hospital. So that gives some kind of confidence to people. I would certainly agree to you also, but certain people do insist and do try to get admitted even if that is not required. So through my various channels, I ask repeatedly them, just check your for vitals, your temperature is not high for a very long time, and your respiration is normal. Your saturation is more than 94 and 90, 93 and 94%. So you don't need admission factor. The virus, it just comes and goes by its own. But in case your saturation goes down and you have persistent fever for more than 7 days, your cough is not getting controlled and you're getting dehydration or uh, persistent vomiting, etc., then these are the indications for getting admitted. Unnecessary, you should not get admitted, you should occupy the bed. And once your doctor is saying you are fit to go home, please go home. Don't stay 2 or 3 days extra, because every bed is vital. And there are people who need more than you these beds. So I think one should be very, very about.
And one question, of course, which has again gained a lot of attention, is that when you compare it with Bombay and how people are saying that Bombay has tackled it so well, that the cases are coming down, and then Delhi, of course, it seems to be mounting the whole problem. What would you say about that, Dr. Gupta?
Yeah, I think you must try to understand what is the epidemiological pattern. Now these they always come in waves. So first, this wave started somewhere in beginning of mid-January from USA and UK. And you see the pattern, you always, even the earlier wave, Mumbai and Maharashtra were, they were affected almost 15 days to 20 days earlier to Delhi. So same pattern is happening also in last 3 or 4 days. We are seeing that the positivity rate is declining in Delhi also. It went up to 36%, today is almost 24%. So we are witnessing the same pattern. Mumbai started declining almost 10 days back, and we started declining in 3 or 4 days. So I think this pattern is going to continue. That's how these virus behave.
Okay, and in terms of facilities, I'll come to you again. We're talking about ventilators. We're talking about how much of it is being used. I mean, we're also talking about at this stage, even how bureaucratically we are looking at things. Somebody would say there are hurdles there. Somebody would say there are coordination problems. There are things available. There are things being sent. But I mean, whether it's available to a common patient or not is being questioned. Also, what would you say about that?
I think Delhi last day we handled it very well. Even this day we handled it very well to begin with. But last 10 days, as I have been telling you repeatedly, the only thing which really crumpled us down was the availability of oxygen. We don't have any problem of beds. We don't have any problem of hospitals. We don't have a problem of healthcare workers. We don't have problem with oximeters. We are getting regular calls. We are going regular calls to the patient who are at home. But oxygen is something which is not in our hand. Delhi is not an industrial town which doesn't produce oxygen. It doesn't have its own cryogenic tanks. It has to be brought from somewhere else. It's not about political.
But shouldn't the drug pricing or these medical facilities should be also looked at in a controlled manner? For example, you mentioned oximeters. I mean, different shops would have different prices for that. Some would be very exorbitant. Somebody wouldn't know which price should I really be buying it at. Things like that.
I think these things always happen in society. And I think, as I said, so good and bad difference are there, and it's the collective responsibility of all of us. Now, unless people man their way, I think everybody is affected. Every family is affected. If you're doing this hanky-panky, then you are also in the same boat.
Okay, let me go to Dr. Bishwajit. Dr. Bishwajit, since you are looking at internal medicine, what are the things that, again, a patient should be doing? We're talking about home isolation. Now, what one should do in home isolation, what one should do when somebody goes to the hospital. How can one, first of all, even beyond the doctors, prepare oneself much better to understand and deal with this disease?
I think first thing is not to panic. It's easy for me to say, but when we panic, we get confused, we misunderstand things, and we do things in haste, and that can cause it's not good. I think we have to be cautious instead of being fearful, instead of panicking. I think that's the first thing. It's easier said. Now, if somebody is infected and the first thing is to see whether they are well or not. So all those patients who can eat and drink well and can walk for 6 minutes, so they can walk inside the house and they got no breathing difficulty, they don't need to go to the hospital at all. So eating and drinking well, and they can walk around for 6 minutes, you stay at a home and you recover from there, because it's much easier to recover in your own home, because it's nicer in your own home. It's nicer in your own bed. Do you mean? It's bad. And moreover, we do not want to strain the hospital if you do not need to go to the hospital. But suppose if somebody is not eating and drinking well and they're becoming quite dehydrated, especially in the elderly population, then they need to get medical assessment, or they got breathing difficulty. If somebody cannot walk for 40 steps, 40 steps, and they get breathing difficulty, then they need to get a medical assessment. But during all this time, what they need to do is to make sure they're eating and drinking well. I cannot emphasize the importance of good dietary intake and fluid intake. It is integral to any diseases, cancers, anything. It makes the body needs the energy to recuperate, and this is what we need.
Sure.
So
one thing I want to ask you, since you hail from Manipur and we are talking, in fact, we have a series looking at Northeast. We've been talking to some of the senior people, authorities and experts from there. What would you say? I mean, Northeast, initially we thought that things were, okay, under control. But as I'm talking to them, we hear that the cases are rising there as well. So there are problems sometimes we hear is of connectivity, whether the hospitals are really equipped or not. What would you say? Are you in touch? Do you have any idea, or do you have to say anything on that?
I'm closely in touch with my colleagues, because we got lots of medical colleagues, and it's really, really concerning and really struggling. I mean, people are trying to find oxygen, and I was quite surprised because we thought we do not have that many patients, but we are seeing lots and lots of patients and lots of unwell patients. The beds are full, and now it's about what to do from there. Yes, because this is why it's so important that people's behavior with regards to hand washing, with regards to meeting people indoors and outdoors, they have to change. We cannot let it continue and make things worse. Now, other one that I'm quite concerned about is when people go to hospital, beds are full, and their loved ones cannot be seen by doctors and nurses, then there is what we call conflict. There is tension, there is stress. And as a result of that, incidences can happen, where we have heard about, hospital being, trashed.
In fact, we saw some of these problems here in Delhi, where we saw some of this anguish and anger converting into kind of scuffle where health workers, and we really salute their courage, but, despite their best, efforts and endeavors, at times they have to really bear the brunt of dealing with the situation. And my heart, of course, goes out to them.
Yes.
Before I go to Dr. Gupta, are there questions? Because Dr. Gupta, I'm aware, has little time, and after a while he'll have to go and attend to his urgent matters as well. Are there questions coming in? Any? We try to, in fact, look at a lot of people from Northeast also, since if they are here in Delhi or there, then they can also, generally ask you certain things. Is there any question coming in, Sneh, from the team or anywhere?
No, ma'am.
Can I make a comment? Again, sorry, Rakhi.
Okay, I thought at least maybe Gitanjali and her team were there. Never mind. So I think since everybody thinks if I'm there, then they think that all the questions can be asked by me, Dr. Gupta. Since you'll have to go, this sense of desolation, the scientific temperament that we are also talking about, and we are saying how the scientists, how the experts are really studying and looking at things. Sometimes what we hear from everyone, including the authorities, that we are trying our best, we are looking at coordination, but on the ground, situation is actually very troublesome. We are seeing a lot of us today. Also, we lost some of these eminent journalists who are no longer with us. At this stage, what would be your advice of looking at the road ahead? I mean, what is that direction, the positive direction that we can look at, Dr. Gupta?
No, you can take it that way. It's a struggle, two-way struggle between humans and virus. We are trying to eliminate the virus, and the virus is trying to survive in our body. That is his tendency. It's our duty to eliminate. Now, for medical science, a problem of this magnitude, something not we are very familiar with. Some new virus comes up and suddenly engulfs the whole of the globe. Now, yesterday on TV channel, someone asking me why you doctors keep on changing your advice. 6 months down, you were saying something else. Today, I see you saying something else. Tomorrow, you were saying something else. But that is true about medical science. When you encounter a problem based on our previous experience and my hypothesis, we recommend some medicines or we recommend some tests. But down the line, we keep on revisiting our treatment, revisiting our tests, and we keep on re-scrutinizing our own way of handling things. Then we give advisor, then you eliminate certain drugs, you add certain drugs. That's how you keep on changing your strategy also. Then that's how medical science has been working for decades. We have our own checks and balances. So that's why probably someday we'll hear some advice from me. Maybe down the line, a couple of months later, I can advise something else. That's a pretty okay with medical science. So that's how things are happening. But what worries me is that the virus is probably one step ahead of us. The moment we come up with some solution in form of drug or maybe vaccine. What my immediate worry is that unless this virus changes some mutant some other strain where he is able to escape more and more my antibodies which are there either because of previous infection or because of the vaccination. Then what will I do? That is there with the fear is the X series roaming in. The best way to prevent or flatten the next wave is to have a massive vaccination drive so that virus doesn't have a sufficient time to stay in the body and mutate. So that's what I can, as a doctor, as a scientist, can say that we have to go all out as a war against this virus. We cannot be complacent. The two things cannot go together. Either you will win or you lose. We have to contain this virus as early as possible.
Okay, representing doctors' fraternity, what would you say in terms of the whole health framework that we are looking at? What would be the learnings, Dr. Gupta, at this stage as to what can we do better for even doctors? How doctors can look at things, making it better for others? What kind of insights and learnings are there on the behalf of all these doctors?
For my doctors, I think it has been more than one and a half year, almost 1.5 years. They are tired. They are tired there, but they are still their morale is still very up. They are still there to fight it out. But when we see the things, authorities or government or the people.
No, when a doctor says, and I've heard this, saying that even I can't get a bed if I want to, because this is what we've heard sometimes. That kind of thing coming from a doctor breaks our heart. I mean.
Yeah, I totally agree with this. These things do happen when there were huge crisis of beds. A lot of doctors were like, they were also finding it very difficult to get beds. So that's why I requested also to the authorities, at least you have some facilities, maybe 20, 30 or 40 beds of dedicated medical staff, because medical staff are your soldiers. But you can't help your soldiers, you can't keep them healthy. You can't win the war. So ultimately, you have to make some arrangements. So doctors, at least they can find it easy, even in case they or their family gets sick, they should be given priority in getting beds.
Sure. And now go to Dr. Bishwajit. Dr. Bishwajit, Dr. Gupta here would understand that some of the senior doctors, I mean, we heard Dr. Guleria, for example, Director AIM saying that, CT scan, so much of use of CT scan is not needed. This is what we heard on TV when he said that maybe it affects, and it is almost like saying, if I read correctly, like 300 X-rays, which is not really needed at times. So things like these that people think are very important because they're in a hurry or panic. What are these things that we should avoid, and what are the right things to do?
I think, as I said again, do not panic. Okay, do not take decisions in fear, but make decisions on a rational basis. And if you're not sure, discuss with somebody who knows about it, or who is an expert in it. With regards to CT scan, yes, I can understand the panic around it. I have never done a CT scan in the last 1.5 years to diagnose COVID. But we have done CT scan to look for other things that we cannot see with chest X-ray. So if I am thinking about a clot in the lungs, we will do a CT scan of the lungs to see a blood clot, but not. But we rely on a CT scan to do to confirm somebody with COVID. Just to reassure all my medical colleagues as well as the public is, in the last 6 months, so in my hospital, we have seen around 6,000 COVID patients. Unfortunately.
Sure.
So in the last,
go ahead.
In the last, so we have seen quite a lot of patients. Okay. Now I have seen only one patient who had the vaccine and needed hospital. In the last 3 months, I have seen only one patient in our hospital that has been admitted despite having a COVID vaccine. So it's very, very minimal. Okay. In the United Kingdom, there is a concern that the Indian variant has affected, and 16 people were admitted in the hospital. They all had the COVID vaccine, but they're all recovering now. So it means the vaccines help. In my hospital, again, I have not seen even a single nurse or a doctor or a healthcare worker who has been admitted to the hospital after having the COVID vaccine. So it means that COVID vaccines helps, reduces the number of people going to the hospital.
Okay, since Dr. Gupta has to go, I'll ask the same question to you, Dr. Gupta, but we have seen some cases where people have been vaccinated and still they got COVID. Of course, we know that it helps when you get vaccinated, but what would you tell for the benefit of viewers that how much vaccination actually helps?
Actually, there are three points to it. Point number one, the vaccine which are we using in India are 60 to 70% effective. Means out of 100 people, 20 to 30 can still get the infection, number one. Number two, when you give vaccination, you give first dose, after 6 to 8 weeks, you give second dose, and 15 days after second dose, you get immunity. Even if during this period you get infection, you get infected. And third, and the most important, even if you get infection after vaccination, it's more likely to be very mild one. You are very less likely to get severe infection, or you're less likely to get admitted, as the earlier doctor also said. So these 3 points say, because of these 3 points, I would say vaccination is a must.
Okay, is a must, as you're saying, because we've known some people, and of course, so how much of Dr. Biswajit, somebody would say, take a lot of rest. You were saying that you will talk about proning. There are new things keep coming up. There are so many inputs coming, so many videos doing the round saying, okay. So Dr. Gupta, if you would like to leave and if you have some other urgent matters to attend or join another show, thank you so much for joining in here. We'll keep having you in your inputs again.
I'm sorry, I have to be there calling me.
That's all right. Thank you so much for your valuable time. We'll talk to Dr. Biswajit now, but thank you for coming on Her World India. So Dr. Biswajit, so I was talking to you about, these kind of, again, since you're here, and we're really thankful that you're being here gives our viewers and all those people who are watching us the kind of advice that they really badly need. Also clear some of the clouds. What are these best practices, since you're there also, that we should here in India also follow, which helps us? For example, proning is something that everybody is talking about. There are so many videos coming in. Somebody would say, oh, don't take this much of protein, this much of sugar, don't eat this, eat that. And sometimes we get confused because a whole lot of videos are coming in every day. What are some of these good things that we should adopt? What are some of the bad things that we should avoid?
I think the best thing is to please follow the WHO directive, the World Health Organization directive, because those are authenticated. Those are based on evidence. Now, I wish I could quote Indian websites, but I'm sorry, because I don't follow the Indian website, so I don't know which one is reliable. Okay, but I can reliably tell all listeners here, please follow the WHO directive. That would be very, very important and useful. Okay, so That is the first good practice, so that you look into it and find out. Now, with proning is important. Proning is good. It means we lie on our tummy. So we sleep like that, instead we lie on our tummy. What it does is our lungs in the back are bigger. So when we lie like that, because of the gravity, the air goes up. So we got more part of the lungs getting oxygen, more oxygen perfusion. You know, the perfusion with blood going to the oxygen, oxygen going to the blood, and blood or carbon dioxide coming up. It's good. But if somebody needs proning because they've got breathing difficulty, then this is the time to get a medical assessment. I don't want anybody to be at home if they got a low oxygen levels or they can't walk for 40 steps or 40 steps, because what we need to know is whether they got COVID infection or whether they got something else or they got something else on the top of the COVID infection. So you can have lung collapse, you can have blood clots, you can have pus in the lungs. So if somebody does proning because they think this is COVID and we miss a blood clot, a lung collapse, it will make things worse. So in case in anyone who's not able to eat and drink well for a few days, especially in elderly, or they got breathing difficulty, it's time to get a medical assessment.
Okay.
Now, oxygen at home is good, but if somebody is requiring oxygen at home because the oxygen levels are low, below 94%, or for those people who doesn't have a pulse oximetry, they can't walk around, they got breathing difficulty, then it is time to get a medical assessment. Yes, oxygen may be part of the treatment, but oxygen is just one part of the treatment of COVID pneumonia. There are other things. We need to make sure the kidneys are fine, the livers are fine. We need to make sure the heart is okay. So if we need to see the whole person rather than somebody who requires oxygen, because COVID is more than oxygen. There's a lot more than just giving oxygen. Yes, oxygen is very vital. So my advice is, please, good practice is, please get medical advice, assessment if somebody requires oxygen, has got breathing difficulty, and they can't eat and drink. Bad practice.
How much of importance of sleep and rest would you give to this?
So when we sleep, when we take rest, we're requiring less oxygen. So if we are unwell and we're not resting, then we will require more oxygen. And if we are requiring more oxygen, and the lungs are infected and the lungs are not working well, then it will make our body work harder even more, and we get tired. And if we get tired, then this is when respiratory failures and things comes in. So rest is very important. But for those people who are not infected, yes, rest appropriately, but make sure you do exercise as well, because exercise will build our strength, and that strength is needed when we need to fight the COVID infection.
Sure. One thing that I was reading, and it came on a TV channel also, and according to the Lancet, now this virus, now at this stage, especially in India, is being considered to be airborne.
Yes.
And that leads to community transmission kind of a situation. What is the study saying right now? Because earlier we thought that it was through droplets, that somebody got infected, and that's why we talked about social distancing, masking. But at this stage, it's becoming very, very, very intense in terms of how infections can happen.
So with regards to the airborne, it means the droplets that when we sneeze, when we cough, where the virus is present, is in the air. And that will be there all the time. It's been there from the beginning. The only thing is we don't know how much it was there. So I don't know how long they are airborne, because they will eventually drop down, because they are they are droplets. And it depends on how big the droplets are. But we do know these droplets, this airborne, is worse indoors, inside a house, inside an enclosed space. This is why, yes, once we know that this is airborne, and we always knew that airborne, only thing is how long can they remain airborne. In the open environment, not for long, because they get swept away by air and wind. But inside a house, inside a room, it stays longer. This is why The importance of knowing that is that we do not meet people indoors. So yes, it's important to know whether it's airborne, but why is it important to know whether it's airborne or not? Because then we can take actions. And the action is, we know that the virus, when it's airborne inside a room, stays longer. So we do not meet people indoors unless absolutely necessary. In that case, you put the mask on, you do your washing hands properly with the sleeves down.
Okay.
Very, very
Another thing in India which is being talked about is, and I think that theory is now being debated here, is that people, whether in rural areas, were supposed to be not really getting so affected by a coronavirus, whereas some people argued that maybe people who live in urban areas and were more privileged, they were actually getting more affected. Is there any theory valid? I mean, do you think?
I think it's all about content. It's all about content. In the yes, in the previous first wave, there was a view that people who can afford better houses were not getting infected. But now we know that because the virus is more infectious as well. So it's just getting, you're getting more infection because we all live in apartments and flats together. So when people live in congested area, they get infected. Now in the villages, the houses are much more wider, there are more air. So this is why there is less infection. But once the infected person goes inside a house, then things become the same. And I think that's what's happening in the villages in India.
Okay. So as you were sharing with us that you are keeping an eye on Manipur, and as we are also talking to many states we've talked to, I think Manipur is still that we need to go and get some more expertise and insights from there, which we will be doing. But we are keeping an eye there as well. But anything else from UK that you are in, you'd like to kind of add to our insight, something that we can also learn from, some of the best practices?
I think the best practice is to please rely on reliable information like the WHO. All right. There are lots of conspiracy theory. There are lots of Facebook messages which says vaccine doesn't work, vaccine will kill people. Okay. These are not true. Okay. Now, if you have anything like that, please confirm in the WHO website, because what happens is during a pandemic, we get confused, we get scared, we are fearful. And this kind of social media posts by the conspiracy theory, by the anti-vaccine, just doesn't help and confuse people. And we know for sure the United Kingdom has done much better compared in the last few months because of the vaccine and the social distancing. Right now, even though the number of people who died is only 2 day before yesterday, I cannot meet my friends inside my house. I cannot meet anyone inside my house. If I have to meet them, it will be in my garden or in the park. Now, this is, remember, we're talking about just 13 deaths yesterday, 2 days before yesterday. The day before there was, I think, was 3. All right. So in United Kingdom, when 13 people died yesterday, people were, now the whole public health is thinking, why it has gone up to the double digit? We're not talking about 100. We're just talking about 13. And to the public who's listening to this, please, you can make a difference. Yeah, and we have to make a difference. Why? Because we do not want to get infected. At the same time, we want to protect our loved ones, our family, our friends, our colleagues. And how can we do that? We can do that by making sure we wear masks when we're around them, and we do not meet them. You do not meet anyone at all unless you are required to meet. And if you are meeting them, meet them outdoors and just restrict into your own house. And that is the big message that I wish can be listened by everyone in India and can follow, because that is what will stop the virus while we wait for the vaccine to come through.
Okay, so strict discipline, that's what you're also advising here. You're saying, please wear masks, that really protects you, maintain social distancing. And when you say that, you're saying, do not meet anyone. And this you have said quite a number of times, so we must almost remember it by heart. But thank you so much, Dr. Bishwajit, for joining us. I think, and I really think that maybe we'll, in just few days, we will again need you, because a lot of people have been noting down some of your stuff, but I think we need to understand many more things. Right now we have this much of time, so we'll continue to wrap this session, but we will be in touch with you. And I think the viewers are going to benefit a lot from these very simple but very important points that you have to take home after watching this show. So thank you so much, Dr. Bishwajit, from talking to us from London. And of course, Manipur is thankful to you. Manipur, I think on behalf of Manipur, I can thank you from India here for being with us. Our wishes are with you. And thanks also to all these people who are watching us. Thanks to Miranda House Policy Center Gender Lab, also Geetanjali and her team, who've really been gracious in arranging things for us. And we'll continue to work together here. We need more empathy and solidarity. That's what from the platform of Her World India we offer, and we try to bring more awareness through these experts that we bring to you, ladies and gentlemen, on Her World India. Basically, our effort is to bring more awareness, more clarity on things, and also some very important medical insights and advice to all of you. We'll continue to do that. But from me right now, from my team, which has really been working out, the Her World India team, I thank you all. And we will be connecting again tomorrow, day after, and almost every day to look at things. Thank you so much, Dr. Bishwajit.
Thank you very much. Thanks for having me.
Thank you.